Every physician and care provider who has been practicing for a while can tell you stories of people who were hospitalized with an unknown illness and who were cured by reducing the medicines they were taking. A daughter once brought her increasingly confused and failing elderly father into the clinic to see me. He had been living in a Minneapolis nursing home, was taking a shoebox of medicines prescribed by multiple and different VA providers. The daughter asked if there were any changes that might help. She was elated when I dropped the pill count down from 20 to 6. In 2 weeks, he returned to the clinic remarkably improved. Following that move to Brookings, he enjoyed something like 3 good years of life in an assisted living center with his daughter's family nearby until a rather quick death came following an infection. The daughter told me that after stopping all those pills, her father changed from being a zombie back to the living world again, reading newspapers, hanging with new friends, playing pinochle, attending church, and going out to dinner with his family. Medications are overprescribed in this country, and there are many reasons for this culture of pills. Care providers are being pressured to follow healthcare protocols, which are basically recipes for care. These recipes are an attempt to improve quality, but often do the opposite and encourage adding more pills when unnecessary. Other causes include excessive prescribing by the specialists that are also seeing the patient, the time limits that care providers are allowed with patients, and their overzealous wish to satisfy those patients, the pharmaceutical industry's excessive promotional efforts, including their direct-to-public advertising, which is not allowed in most other countries, and the patient's desire for an easy pill rather than a tougher lifestyle change. Healthcare protocols, the physicians, the pharmaceutical industry, and the patients are all to blame for the burden of polypharmacy that has taken hold of our country. Medications can sometimes be helpful and sometimes harmful. It should be a careful, well-trained, and considerate care provider, not a protocol or an advertising campaign that determines when a new medicine should be started. Please do not stop any medicine you are presently taking. However, every time you see your care provider, start with a statement that you're not seeking another medicine unless it's necessary, and ask if there are any medicines that can be stopped.